Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Thank you so much for joining us. As always, this is your chance to get your COVID questions answered live. We got a lot of questions in late last week that we didn't get to, so we may start off with a few of the ones that we didn't get to last week, but it's certainly been a busy few days in terms of COVID news, particularly around boosters. Right now, the advisory committee for the FDA is meeting to discuss 5 to 11-year-old Pfizer vaccine. So my team is watching that really closely. We are planning a press conference this afternoon at 1 o'clock, also with CPS there, to talk in some detail about our plans for rollout, assuming that the COVID vaccine for 5 to 11-year-olds is authorized. So I just wanted you to know we'll be touching in some more detail on that this afternoon. But I really want to make sure we get to your questions, particularly if you've got them around boosters. I also, today, Tuesday, October 26th, we will take your questions directly on Facebook in the box below or on Twitter. You can use the hashtag AskDrArwady. So let's turn first to, as always, our dashboard. chi.gov/COVID- is where you can go to get the Chicago-specific COVID information. And things are looking good here. You see we're averaging 285 cases per day, down 4% from a week ago. We're still over that 200 mark, which marks the transition for us from substantial back down to moderate per the CDC. We get below 200 and stay there. That would be the setting, assuming we continue to have very good testing, that we would be removing the indoor mask requirement. So it's good to see progress there. Hospital data is looking good. We sometimes see some delay in over the weekend from this, but regardless, number of hospitalizations are declining and the number of deaths are declining too. You can see we're now averaging about 2 deaths a day, and we were averaging about 4 deaths per day just a week ago. So all of these are good signs in terms of continued progress of getting through this Delta surge. We're doing about 5,800 vaccinations a day. Across the whole city, all ages, 64% have gotten a first dose and about 59% have completed their vaccine series. And then we're doing more than 20,000 tests, which is very good. And in that setting, have a positivity of 1.6%. Someone had sent in, isn't that the lowest ever? It's not. You can look last summer, we were down actually under a 1% positivity here in June. But nevertheless, under 2% is where we want to stay, and I am pleased by that. I'll just remind you that you can also click along the top here if you want to see what's happening with vaccine, with cases by age, gender, race, ethnicity, or zip code. If you want to look at testing or positivity and see what's happening there. If you want to look at vaccines, for example, here is our age-specific vaccine. So we can see in 12 to 17-year-olds, we're actually doing quite well compared to much of the country, where 65.5% of our 12 to 17-year-olds, so almost 2 in 3, have gotten a first dose, and about 57% have completed that vaccine series. Obviously, we will be adding the 5 to 11-year-old group to this once, assuming that is authorized and we do start to roll this out. So our APPs have also been planning for that. And then you can also look at vaccinations by zip code. I want to show you a little bit more specific kind of update data here. Let me get into the slideshow. So first of all, related to our travel advisory. So 4 more states coming off the travel advisory. And again, just a reminder, our travel advisory applies for people who are unvaccinated, those who are not fully vaccinated against COVID. Recommendation for testing pre and post and quarantine post return if you travel to one of the orange states on this map. What we're seeing here is that overall the country is definitely improving. Georgia, Louisiana, Maryland, and Mississippi coming off the list today, and you can see joining the other states in yellow. And we've had the exact same metrics for this all along. When a state is at less than 15 daily cases per 100,000 with adequate testing, and it can hold that for 2 weeks, that's when they come off the travel advisory. Illinois, incidentally, would be off the travel advisory. We don't report on Illinois, but our average across the state of Illinois is at 12.9. We're the only state in the Midwest that is at that level. And then Chicago is even lower than the average for Illinois at 10.5 cases per 100,000. So continuing to make some good progress there. And there's a number of states that we're hopeful if they can stay under 15 for another week, we would see potentially 7 more states come off that list. So it's really good to see improvement across the country. In terms of Chicago's risk factors here, so you're getting used to this matrix, I think. Our substantial transmission, we're averaging 285 cases per day. We got to get under 200 to get back down to that lower moderate risk. Test positivity is controlled at less than 2%, and we have good both hospital and ICU capacity. Still, the most important risk factor for being diagnosed with COVID disease or being hospitalized or dying is being unvaccinated. That's true in Chicago and across the country. Some of you were writing in that this hasn't held true during the Delta surge. It definitely has. Even if we look just at Chicago, just in the last couple of months of the Delta surge, unvaccinated Chicagoans have been more than twice as likely as vaccinated Chicagoans to be diagnosed with COVID-19. They've been 5 times as likely to be hospitalized and 8 times as likely to die from COVID-19. And that's similar to what's been seen around the country. I also want to just share progress here. In terms of eligible Chicagoans for the vaccine, we are tracking, as you know, by community area here. Goal is to leave no community area behind. All of Chicago needs all of Chicago to be vaccinated in terms of really being able to protect us from COVID, but also do everything we can to limit the emergence of variants. And so citywide, we're at 74.7% of eligible Chicagoans have gotten at least a first dose. We're seeing about a 0.5% increase per week. So we do estimate if we can keep up with that, we'll hit that Chicago 77 goal in about 4 to 5 weeks. It'd be great to hit it even sooner, and we'd like to get to a point where the 77% are fully vaccinated. But you see in the darkest blue here are the community areas that have hit that at least 77% of eligible have gotten the first dose, and then it goes down from there. The most improved communities were on the west side here. East Garfield Park took the cake, so congrats to East Garfield Park for making the biggest improvements in the prior week. And in terms of completed vaccine, you can see we still have a ways to go. City here is at about 68.8% of eligible Chicagoans fully vaxxed, meaning gotten 2 doses of Pfizer or Moderna or a single dose of J&J. And so just a few communities in the darkest blue here that have hit the 77% goal, notably a few on the southwest, which is good to see. So we still have a ways to go. I want to congratulate 4 community areas that reached the 80% first dose coverage mark for eligible Chicagoans. That's Beverly, Edison Park, Hyde Park, and West Ridge. So really good to see that. I also wanted to share some information about boosters. So obviously, we have been giving 3rd doses of vaccine to people who are immunocompromised since late summer. You can see throughout August and much of September here in Chicago, we were averaging about 450 to 500 3rd doses per day, really for people who are immunocompromised. And then September 24th is when the Pfizer booster announcement was made. And we saw an increase. We've been doing about 2,800 boosters a day, really since that point. And then, of course, just over this last weekend, we saw approval for both J&J and Moderna. So we will get into the details of that. But some of you had written in just wondering what the breakdown was of what vaccines Chicagoans had received. And so we pulled that data for you here. Across all of Chicago, where we're looking at the adult age groups, 18 to 64 and then 65 plus. Obviously, those under 18 are only able to get the Pfizer vaccine. We see that if we look at seniors, meaning Chicagoans over the age of 65, 56% have gotten the Pfizer vaccine, 40% have gotten the Moderna vaccine, and 4% have gotten J&J. If we look at 18 to 64-year-olds, still Pfizer's the highest, 60%, followed by Moderna at 33%, and J&J at 7%. So our epidemiologists have been tracking when are people eligible for boosters. And just to remind you, people are now, everybody over the age of 18 are eligible for a booster 2 months after getting a J&J vaccine, and then 6 months after Pfizer or Moderna. And for Pfizer and Moderna, we're especially focused on people who are over 65, who have an underlying medical condition, or who are living in a high-risk setting. J&J, the recommendation is actually for everybody over the age of 18. So if we map this out, let me explain this chart to you. This is Chicago data specifically, and on the x-axis along the bottom, this is the date that Chicago residents would be eligible for a booster. So yellow are J&J, green are Moderna, and blue are Pfizer. And so we already have, as of this week, more than 200,000, specifically 207,182 Chicago seniors that are already eligible to get a booster dose this week. That's 80% of Chicago seniors. So 8 out of 10 chance, if you know somebody over the age of 65, they should be getting a booster right now. And so if somebody, and I'll go into the details of that. So in addition, booster vaccine doses are now available, in addition to being available at pharmacies, at doctor's offices. We are now offering boosters at all CDPH pop-up clinics and events, and we're offering it through our at-home vaccination program. So as you know, the Chicago at-home program has been very popular. You can call 312-746-4835 to sign up, or if you go to chi.gov/COVIDVax, you can sign up there. There's a lot more about boosters. And in fact, yesterday, when we officially opened that at home to boosters, we saw a huge increase, 4 to 5 times the number of people that are calling on a typical day looking to schedule boosters at home. You cannot get an incentive for a booster. Our priority for incentives, the $100 incentive, remains in place for people getting their primary series, their first or second dose. But if you really are not able to leave the house or you have another barrier, we are at this point also scheduling booster doses for people, and especially people over 65. That's who we'd most like to get it. So just on the last slide here, and then I'm presuming we'll answer a good number of questions about this. If you received Pfizer or Moderna as your initial vaccine, you are now eligible to receive a booster dose of any vaccine at least 6 months after completing your initial Moderna or Pfizer series. So at least 6 months after your second dose. And specifically, you're eligible if you're over 65, no questions asked, or if you're over 18 with an underlying medical condition, living in a long-term care setting, or living or working in any kind of high-risk settings. I, for example, had my Pfizer vaccine series more than 6 months ago, and I got my booster, both because I have some underlying medical conditions, although nothing that serious, and because I directly see patients in clinic. If you received your Johnson & Johnson as your initial vaccine, anyone 18 and older who received a J&J vaccine is eligible to receive a booster dose of any vaccine at least 2 months after your initial vaccine. So it's 6 months for Pfizer or Moderna after your second dose, and then 2 months after J&J. And really, you know, this is recommending a second dose, to be clear, as opposed to a third. And we definitely are seeing people choosing to get the Pfizer or Moderna as their follow-up dose after Johnson & Johnson. I support that fully. For people who want to stick with Johnson & Johnson, also good with that. Really, it has been open, so you're able to make that switch. If you got Moderna or Pfizer, I would recommend sticking with the same one that you got initially. And if you got Johnson & Johnson, I have been advising folks, if they got J&J, depending on the reason they chose J&J the first time, if they're going to get that booster, I've been recommending getting likely one of the mRNA series, the Moderna or the Pfizer. That's where we saw the biggest increase in antibodies in the studies. But getting that second dose of J&J also majorly increases the protection. And just to sort of finish this off, my most important thing, we can come off the slides, the most important question and major point is getting your first doses of vaccine. So there's a lot of focus on boosters. I want folks to get boosters, but I am way more concerned about you and anybody who has not yet gotten their initial doses of any vaccine. So we continue to only require the initial vaccine series, so 1 dose of J&J or 2 doses of Pfizer or Moderna for any public health purpose, any employment purpose, any vaccine requirement purpose. You know, it's been really nice. I've had the opportunity to go back. You know, I was in, I've seen a couple of shows now actually at the Goodman Theater. They're requiring a vaccine card. I was at the opera. They're requiring the vaccine card. You just need 1 J&J or 2 Pfizer doses or 2 Moderna doses to be able to get in there. But where we are seeing some breakthrough infections, and I can talk more about that if people have interest, it does tend to be in people over 65 or people with serious underlying conditions. And those are the people who we especially want to see getting the booster. I'll tell you, I had some family members just very recently get diagnosed with breakthrough COVID. They had received their initial vaccine series but had not gotten a booster yet. One, for example, had gotten Moderna, and the Moderna booster had not yet been authorized. I'm not very worried about those family members because I know that they are very protected against hospitalization or against death. Obviously, it is still a positive COVID infection. The contact tracing need to be done, and you know, you want to take that seriously, especially in people who are older. But I don't at all have the same concerns because the great majority of the time, if people have had that primary vaccine, they continue to be very well protected against the really serious outcomes. So I hope that helps put some of that in context, and let's go ahead and get into questions. Okay, so first, right off the bat, I just want to note it's really interesting to me. There's a number of you who watch every time I do this and clearly have a lot of questions about the data that I show, or even my motivations behind showing it. So I want to say thank you for continuing to watch. I'm interested in your questions. I'm interested in what data you're looking at, where you think what we're sharing is not appropriate. So I'm going to just start off with a couple of those. Sherry on Twitter says, show us the data that COVID exists. Why are you saying Delta variant when tests don't test for variants? Why are you still making people test when PCR tests have false positives? Who is paying you to lie about the inflated numbers? So let me take those kind of one at a time. So if you have been lucky enough to not have anybody in your life touched with COVID, boy, you are not like the majority of Chicagoans or the majority of Americans. COVID very clearly exists. Unfortunately, we are still having multiple people not just be hospitalized, but die with COVID every day here in Chicago and around the world. So if you would like to be specific about what data you'd like to see, I'll show you. I've got the genetic code for it. I've got the electron microscope of it. But more importantly, I've got the data of how people are getting sick with it. So I like this question. Why are you saying Delta variant when tests don't test for variants? This is a good question. This is one we get a lot. When you get your COVID test, the only thing that you get back right away is whether or not you are positive for COVID disease. That is how those tests work. That is how those tests have worked from the beginning. That is what is needed in terms of the decisions your doctors need to make, or you need to make, or public health needs to make. After the initial testing that is done, that is just plus minus, behind the scenes, there is a huge amount of additional testing that goes on samples that are collected around Chicago, around Illinois, around the US, around the world. And to see what kind of variant it is, or to look at the genetic makeup, the scientists are actually taking those same samples and they are getting the entire genetic fingerprint, literally every base pair that is in that particular COVID virus. And so that is being done, uploaded, shared around the world so that we're able to see what the variants look like. So behind the scenes, you don't receive right away that this is a Delta variant. It doesn't change anything that we would do for you clinically. It doesn't change the way you need to isolate. We need to do contact tracing. But there is a lot of work to see how the virus continues to mutate. And so I can tell you right now, still very good news. 99.9% of everything that is being sequenced, that's the medical term for it, around the country, here in Chicago and Illinois, 99.9% of it continues to be the Delta variant. That is good news for the most part. It does mean this Delta variant is a lot more contagious. That's why some people were asking, why do I need to test twice a week? You know, the Delta variant moves faster. People typically, we're seeing it more within 4 days instead of 6 days of when people tend to test positive after exposure. But also, the good news is it outcompeted really all of the other variants, and we've not seen another variant emerge that can outcompete Delta. That's good. If we can get more of the world vaccinated, if we can sort of get past this, not seeing a lot of ongoing mutation is exactly what we want to see on the virus side. So I hope that helps. So why are we making people test when PCR tests can have false positives? So another good question. So PCR tests are very, what we call sensitive. That's the specific term that we use in public health and medicine. It means they are really going to pick up COVID if it is in your nose, even if that COVID perhaps is at a level that is now very low level, or it can even pick up dead COVID. So a PCR test is positive. Like when it is positive, it is COVID. It's not that we are having, quote, false positives. It's that if you keep testing people with a PCR test, say you test them, they're having symptoms, they're positive, it's positive, no problems. Even if they're not having symptoms, you test them, it's positive. We trust that. We don't say that's a false positive. But what we see sometimes is people will try to take another test 10 days, 12 days, 14 days later, 20 days later, and that PCR test can stay positive. It does not mean that person can still spread COVID. It does mean they had COVID disease, but it's why we don't require a negative COVID test to return to work, to return to school, because that PCR test in particular can stay positive for longer. So I hope that helps answer the question. But PCR tests, antigen tests, any of these tests, if they're positive, we treat them as positive because the chances are very good that, in fact, that is COVID disease. And then finally, who is paying you to lie about the inflated numbers? So nobody is paying me to lie. Nobody is paying me. There are no inflated numbers. I don't get any more. And I get a lot of questions like this. I don't get any more money when more people are vaccinated in my clinical practice, in my public health practice. I certainly don't take joy in the fact that there are more than 6,000 Chicagoans who have died from COVID, 99% of them not vaccinated. But my entire goal here is to help people protect themselves, protect their families, protect Chicago against this disease. All right, let's also take 19MO86 from Twitter, who has asked a number of times now, please provide 1, 3, and 5-year studies for the vaccinated, especially for vulnerable populations like pregnant women or kids 5 to 11, those with pre-existing conditions, those with natural immunity from prior COVID infection. All right, so let's kind of do a quick review here on timelines and talk a little bit about how vaccine work. So COVID disease has only been known about for not even 2 years at this point. So obviously, there has not been the ability to do a 5-year study of COVID virus even. COVID vaccines, we do have data on those now that are going back, let's see, going on 1.5 years or so, and that is the longest that vaccines have been available. But what I think you're getting at here, and what I want to just reassure you about, is that there has never been a vaccine with problems that show up related to the vaccine years later. That's not how vaccines work. Any vaccine that's been authorized in the US, if there's ever been, or not even authorized, it's been tested in the US, where we've seen problems with it, that shows up within the first typically few weeks and always within the first 2 months of being vaccinated. So this idea that there are somehow going to be effects that are found years after vaccination, there's absolutely no science behind that. You're not going to find anybody who studies vaccines at the scientific level, at the epidemiologic level, who has concerns about it. The vaccine, remember, does not stay in your body. It's literally gone within a number of hours to days. All it is doing is teaching your cells to make the proteins that help your immune system protect yourself if you're exposed to COVID again. The studies have been done for pregnant and nursing women in terms of that vaccine safety and efficacy. And in fact, you know, the obstetricians across the country, the CDC really doubling down, because unfortunately we still are continuing to see pregnant women less vaccinated, and we're seeing pregnant women, you know, dying of COVID and their babies dying of COVID. And it is true that we do not have 3- and 5-year studies for people who are vaccinated, but we don't need them, honestly. And if you're finding any evidence that you've got any vaccine, like, I'd love to see what you're looking at that is suggesting a vaccine that had problems years after the fact, because I'd like to see what you're reading. So please send that in if you haven't. Okay, Jess P. from Twitter. Are undocumented immigrants in Chicago included in the Chicago population and the number of Chicagoans vaccinated? Yes, on both counts. We have been extremely careful here to make sure that we don't require documentation, you know, formal documentation around vaccination. We've done a lot of work with advocacy groups and immigrant groups here around vaccine confidence, around protection of data. So yes, we definitely include undocumented immigrants, and we have worked hard to make sure that vaccines are available to that population free of charge in a way that does not in any way put their documentation status at risk. So Alexandria Deanne on Facebook says, for the booster shots, is it better to mix and match? My mom got J&J. I'm wondering if she should get mRNA or another J&J. What's the best advice? So the official advice on this is that if your mom got J&J, she should get a booster shot. And the most important thing is that she got a vaccine to start with, okay? So thank you. Good job to your mom. She remains, you know, good protection for hospitalization and death. However, she should get a booster vaccine. And if it were me making the decision for my mom, not knowing, you know, all the decisions that went into why she decided to get J&J the first time, you know, I would probably go, in the case of J&J, with one of the mRNA vaccines as a booster dose, either the Pfizer or the Moderna. And that's just because in the studies that were shared with the FDA, where they did this mix and match study, the antibody protection level went higher, specifically when J&J was followed with an mRNA vaccine. We actually didn't see the reverse necessarily, so I think this is mostly for folks who got J&J. But the other good news is that when J&J submitted its data and did a second dose of J&J, there also was a good increase in protection. And remember, the main difference between J&J and Moderna and Pfizer, they have different mechanisms, but J&J was just one dose to start with. So I continue to tell people, you know, every day, I'm still talking to people, like on a one-on-one basis, who have not yet gotten vaccinated. I tell everybody, if you're just going to get one shot, like one time, you're really afraid of needles, you really just are so worried about a side effect, whatever it is, you're over 18, you want to get one, you're trying to get a requirement for work done, whatever it is. You want to get protected as quickly as you can. If you want to get one shot, get the J&J. One shot, that's still the best protection. One shot of J&J is better than 2 shots of Moderna. It's better than 2 shots, one shot of J&J is better than 1 shot of Moderna or 1 shot of Pfizer. However, 2 shots of Moderna or 2 shots of Pfizer are showing to be more protective at this point than the 1 dose of J&J. So the recommendation, therefore, is for everybody over the age of 18 who got the J&J, recommendation is basically get a booster, get that second dose. You're still considered vaccinated. You've gotten the most protection from getting that 1 dose. But I would, in your situation again, if somebody got the J&J, they're over 18, my recommendation is to get a booster dose. And if it's all the same to the person making the decision, I would probably go with either a Pfizer or Moderna. I think that's what the data suggested was the best. But if somebody got the J&J and they feel confident in getting a second J&J, that's also a good decision. So I hope that helps answer the question. And again, most important is having gotten that first dose, and then for J&J, do go ahead and get the booster. And for J&J, reminder, that's 2 months after the second dose. So most people who got J&J would already be eligible for that booster. Okay, Sarah Garza from Facebook. Will the dosages for the boosters remain the same, or are there any changes? Great question. So the Pfizer booster is the exact same. So I got a Pfizer booster the same day I got a flu vaccine, and I got the exact same vaccine that I'd gotten 2 of back more than 6 months ago. J&J, exact same vaccine, exact same dose. Moderna, the booster is actually a half dose of what Moderna was given originally. And this gets into a little bit, the Moderna mRNA dose was a little bit higher than the Pfizer mRNA dose when it was initially developed. And so for the booster, for Moderna, the mRNA, the only active ingredient, the directions for your immune system is at half of the dose. And some of that is, around the potential. We want to make sure if you're boosting, you're getting the immune response with as few side effects as possible. I can tell you, I actually did not, I've been very lucky. I've had really no side effects after any of my now 3 Pfizer vaccines. I get a little bit of a sore arm. I had a little bit of a controlled trial for myself because I got my flu vaccine in the left arm. At the same time, I got my Pfizer booster in the right arm. My left arm, my flu vaccine arm, was actually a little bit more sore than my Pfizer vaccine arm, but I didn't have any other notable side effects. And I've been hearing anecdotally from people who are getting boosters that they're not having as much side effects as they did after the second dose, but I want to actually get some science on that. CDC is collecting it, so we'll be sharing it. Okay. Patty Graff on Facebook. Because Moderna boosters will be drawn from the original vial, how great is the chance for entry of bacteria? I'm actually thinking of getting Pfizer because of this possible situation. Okay, Patty, really good question. Let me clarify this for you. So it's a really good question. So, and it just has to do with the way we're talking about it. So when people are talking about Moderna being drawn from the original vial, all they mean is that you can draw the booster shot, meaning a half dose, from the same vial that you're drawing a full dose that you would for a first or second Moderna vaccine. So it's not the original vial like from months ago. You're absolutely right. We would not want somebody using a vial that had been opened months ago. They just mean that you can use the same vial. There's not a separate shipment for Moderna vaccine, even though the booster is half dose. And so in all cases, adult vaccines, child vaccines, Moderna, Pfizer, J&J, as soon as you puncture the vial, there's actually a limited number of hours that you can use, that you can draw vaccine out of that vial. And so, the nurses will draw up, up to 10 doses, for example, all with a new needle in a sterile process out of that vial. You can only use that for a few hours. And then if we don't give all the vaccine away, you actually discard the rest of that vial. So really good question, but not something to worry about. If you got your first 2 Moderna doses, go ahead and get your Moderna booster. No concerns about bacteria. CDPH does a ton of work around sort of vaccine safety and training and shipments. We've got one of the absolute best programs in the entire country around this. And I have every confidence that no matter where you are getting your vaccine in Chicago, through a pharmacy, through a doctor's office, through a clinic, through at home, you don't have to be concerned about that. Good question. All right, Carrie Poby on Facebook. Are there plans to have mass vaccination sites for children or vaccinations through the public schools, or will it only be through physicians and pharmacies? Great question. So we're going to be talking at 1 o'clock this afternoon in some more detail about the plans for children here, but just very high level. I can tell you that we've got plenty of physicians and pharmacies here in Chicago that are already we've already been working to schedule vaccine to be delivered to them, assuming that we do see approval here. So we'll be talking some details. And yes, we of course are also working with not just the public schools, but the charter schools, the private schools, to make sure that there are options through schools. And then related to mass vaccination sites, CDPH, not mass in terms of United Center level, but we will certainly be once again standing up on weekends, for example, at city colleges, some opportunities for children and families to be vaccinated. So we'll be sharing some more details about that at 1, but let me tell you, my team has been planning for months and months and months around the availability of child vaccination. And because we anticipate if this vaccine is approved, because I see some questions about this too, it would be authorized for children. It would be the same ingredients. So the Pfizer vaccine, the same ingredients, which is just the mRNA and then sugar, salt, and fat to help stabilize it. That's it. The same ingredients, but only a third of the dose is what's going to be is what they're looking at for authorization for 5 to 11-year-olds. So unlike I was just saying, the person who asked the question about the vials for Moderna, you're going to be able to draw out of the same process. It's going to be a separate pediatric vaccine preparation. And so we are absolutely planning to have that widely available. There's been a lot of work behind the scenes. I don't anticipate people in Chicago having a lot of difficulty getting their children vaccinated, and we'll share some more details about that. There has been production already of the vaccine and a lot of plans around shipping already, even for when it's available. So Amanda Ibarra on Facebook says, I have a son who is a type 1 diabetic. He's 7 years old. How soon can he get the shot? Yeah, so for a 7-year-old type 1 diabetic, that's certainly somebody we want to get vaccinated, as you know, with an underlying condition. So the sooner, when he can get the shot, so let's just remind everybody of the process here. Today, the advisory committee for the FDA is meeting. You can stream it, you can look at it yourself online if you want to see the conversation. They're looking at all the data. They will make a recommendation to the FDA whether to authorize vaccine for 5 to 11-year-olds. I expect that vote will happen later today. I don't know that for sure. It will probably be later today. And then the FDA will formally make a decision and an announcement on whether the vaccine is authorized. After that, I expect that to happen in the next few days, either way. Assuming that it is authorized by the FDA, then the ACIP, the Advisory Committee on Immunization Practices that advises the CDC, that group of external experts meets, looks at the data. They're the ones who put the specifics on it, like the details of dosing and timing, et cetera. They're the ones who say, for example, that it is safe and appropriate to give this COVID vaccine to 5 to 11-year-olds at the same time they're getting a flu vaccine or the same time they're getting their other childhood vaccines. So they also need to weigh in. That meeting will likely be later this week into sort of weekend, possibly early next week. And so I would expect, if all of this is authorized, as soon as really next week, that first week of November, we would start having vaccines potentially available for children. We don't know the exact dates around that yet, but if the FDA gives the authorization, we will already start with some of the shipping and distribution so that we have things in place for after the CDC authorizes it. So given that your son has type 1 diabetes, you obviously have a pediatrician. You can start with asking, your pediatrician's office if they expect to have COVID vaccine. We've surveyed all the pediatric providers. Every pediatric provider can get vaccine. There will be more than 70 that very first week that'll be getting more than 300 vaccines apiece. And the hospitals will have vaccine available. The pharmacies will have vaccine available for children in that whole age group. So lots of places you'll be able to get vaccine, really just probably, you know, if this gets authorized, just in the next week or two. All right, and Amanda was just a follow-up. Can we get more testing sites for children to get tested instead of taking them to the ER? Yes, please. Don't take kids to the ER to get a COVID test. There are lots of opportunities for COVID testing. They're around the city. You can use the at-home tests if you want to, that are widely available. Many schools have testing site availability. Your pediatrician's office can help guide you. Your federally qualified health center, if you don't have a pediatrician's office, even a pharmacy, lots and lots of sites. Please don't go to the emergency room to get a COVID test. It's not a good use of time. It, you know, has the potential to expose you and your kids to, you know, more illness. So chai.gov/COVID test has more information about testing options, including what's available for kids. So good question. All right, Melanie Taylor from Facebook. Will kids be eligible for getting vaccinated at home? My oldest, who is autistic, is already vaxxed, but getting his younger siblings and him into a clinic altogether when available to 5 to 11-year-olds will be a huge challenge. Yeah, so good question, Melanie. And I see Juana Pena on Facebook has the same questions. Will 5 to 11-year-old vaccines be part of the Protect Chicago at Home? So right now, the Protect Chicago at Home program, as you know, is open to anybody over the age of 12 in Chicago. And you can get your first dose or you can get your second dose. And then just this week, we've also opened up for people who need boosters, especially if they have trouble leaving home. We offer the Pfizer and the J&J vaccine, both for the primary vaccine series as well as for boosters through that program. We will not, in the first week or two, have you won't be able to make a specific appointment for a 5 to 11-year-old. We expect that in just a few weeks, once we've gotten over some of the really larger events that we're doing, that we will move that capacity into at home. But what I can tell you is that in these first few weeks, if you are making an appointment for somebody who is older, who needs a vaccine, and there's a 5 to 11-year-old there, we are more than happy to vaccinate that child at the same time. So I anticipate, and for situations like yours, this is exactly what we're thinking about, that we will have, that we will be opening that to children through the at-home program, but that will be a little bit later in November. I would expect roughly from mid-November on, and sort of more to come there. The first few weeks are really going to be about making sure that we can get a lot of kids through a lot of sites quickly. And again, we're trying to use this opportunity. So, I mean, just as a corollary to that, if you are if you've not yet gotten your first or second dose and you're 12 and older, like, please be calling right now, because we do expect there to be a lot more demand, right? Once the 5 and 11-year-olds, we roll that in. So we always maintain capacity first and foremost for those first and second doses. That remains our top priority. But we're now, we've got some open for boosters now, and we'll go from there. So good question. All right, I think we are just about at time. There's a few more questions about here. When can I get a mixed booster? I had J&J and want Moderna or Pfizer for my booster. I went to this is Stephanie Ann. I went to Walgreens and they said they weren't authorized to give mixed boosters yet. So I don't know exactly when you went. This authorization just was happening over the weekend. As of yesterday, I would expect any pharmacy, any provider's office, our own CDPH clinics, et cetera, can also now offer that mix and match. So I would fully expect, and we've had conversations with Walgreens, that as of now, you would be able to do that. I think if you have a question, you could certainly call ahead, but we have shared the information with the pharmacies, with the providers, et cetera, that this mix and match is appropriate, and I hope that can help. So. And booster shots, a couple more, just when booster shots, will booster shots be available for everyone? There are booster shots, as you heard, available for everyone over 18. We especially want people who got J&J. That's the most important. Everybody over 18 with J&J who got a first dose, I mean, it would have only been a first dose. We do recommend you get a second dose of any vaccine 2 months after that first dose of J&J. And then otherwise, if you got Moderna or Pfizer first and you're over 18, if you've got an underlying condition, if you are working in a higher risk setting, if you have other exposures that you're concerned about, you can get a vaccine. You don't need a doctor's note on that. CDPH does not have to sign off. Boosters are available. We have plenty of capacity. That's the other thing, right? So I'm not worried about running out of vaccine. But the most important thing, honestly, especially if you're in that younger group, is if you know other people in that younger group who still have not gotten their first and second, that's by far the most important thing. Anybody over 65, though, we want you to get a booster, please, because I just don't want you to have a breakthrough infection. So I hope that helps. I think just with time, there's a few other things we didn't get to hear. Some people about mandatory masks. Our numbers are going down. When we get below 200 per day with good testing, per the CDC, moving out of that substantial transmission risk, that's when that would be coming off, and I hope we get there soon. Folks may not be aware, but this continues to be the U.S. is approaching COVID in a much more open way than many places are. I was reading an article this morning about a city in China of 4 million people that is larger than Chicago that had 6 cases of COVID diagnosed in a day, and they are in total shutdown. I don't think that's appropriate, but I just want to put this in some context that there are really different approaches here. My goal is to stay open. Those masks are part of what help us do this, and I think especially if we can get a lot of younger kids who haven't yet been eligible for vaccine done, we're going to keep seeing progress. We'll see. So no change in that plan. Thank you very much for joining. We will be back at 1 o'clock. I'll be on with Pedro Martinez, the CEO from CPS, and we'll have a focus on child vaccines at that point. Thanks so much. We'll be back Thursday for more of your questions too. Bye.